Welcome to the Explainer. We see them in clinics, hospitals, and basically every medical drama on TV. But how often do we actually stop and think about the hidden engineering that makes clinical devices tick? Behind every routine checkup and complex surgery, there is a remarkably precise piece of equipment doing the heavy lifting. So today, we're going on a medical toolbox tour. We are taking an exclusive look under the hood to demystify these clinical devices and understand exactly how they work. All right, let's dive right in. Our visual roadmap today is taking us through 4 key areas: stethoscopes, suction machines, operating theater tables, and nebulizers. Starting us off, Section 1, stethoscopes, hearing the unseen. Now, the stethoscope is arguably the single most universally recognized symbol of medicine worldwide, right? But before we write it off as just a simple prop hanging around a doctor's neck, let's use a little X-ray vision to trace the journey of a sound wave through its hidden acoustic complexities. You know that freezing cold metal disc doctors press against your chest? That's the chest piece, or resonator, and it actually has 2 distinct parts. The larger, flat metallic disc is the diaphragm. It's surrounded by non-chill rings and is designed specifically to pick up very high-pitched sounds, like heartbeats. Flip it over and you have the bell, that hollow piece of metal with a hole in it. That side is perfect for picking up low-frequency sounds and subtle body vibrations. From there, the sound travels up the flexible polyvinyl chloride or latex rubber tubing. This tubing is absolutely crucial because its flexibility lets the doctor reach the patient easily, all while protecting the acoustic wave inside. The sound then passes through the metallic binaural springs hidden up in the headset, straight into the ear tips, and finally into the listener's ears. It is basically pure, uninterrupted acoustic engineering. But as we know, medicine is always evolving, and not all stethoscopes are purely acoustic anymore. Let's contrast the classic acoustic model with the modern electronic version. Physically, the structure looks very similar, but the electronic stethoscope incorporates a really simple yet totally game-changing element: a battery. By adding electronic components, it drastically amplifies those internal sounds, making them far more audible than what an acoustic model could ever achieve on its own. It's a brilliant bridge between a classic diagnostic tool and modern tech. So what happens when this precise acoustic pathway gets compromised? The real-world stakes of poor sound quality are incredibly high. I mean, if a practitioner can't hear a heartbeat or blood pressure accurately, they can't make a correct diagnosis. And yet, the causes of failure are often stunningly mundane. A loss of sound quality might literally just be an obstruction, like ear rocks or dirt clogging up the ear tips. Or it could be loose parts in the chest piece or a cracked rubber tube, letting the sound escape. A remarkably simple fix, like clearing out dirt or replacing a cracked PVC tube, instantly restores the stethoscope to its full diagnostic power and ensures patient safety. Moving right along to Section 2, suction machines clearing the way. Let's step out of the exam room and escalate into the high-stakes surgical environment. Suction machines, also known as aspirators, are essential devices used to evacuate gas, fluid, tissue, or other foreign materials from body cavities during medical procedures. So how exactly does an aspirator work? Let's break down the physics of the vacuum. Think of it like a highly specialized medical-grade vacuum cleaner. Step 1. An electrically powered motor generates a pumping action. Step 2. That pump creates a powerful suction, or vacuum, inside a plastic or glass collection bottle. And Step 3. The reduced pressure inside this bottle creates a literal vortex that draws fluid from the patient through a rubber delivery tube. It's an amazing conversion of electrical power into pure fluid-drawing mechanical force, keeping everything safely trapped in the reservoir jar until it can be disposed of. And this brilliantly illustrates the complete portable system in action. One of the absolute most critical safety features you'll notice is the cutoff valve. This valve acts as a definitive barrier. It stops drawn fluid from accidentally passing from the bottle into the electrical motor itself, which, let's be honest, would be disastrous. You can also see the pressure gauge and the critical vacuum control adjustment knob. That knob allows the clinician to perfectly calibrate the suction strength, so it's strong enough for the procedure, but entirely safe for the patient. But just like any machine, aspirators can fail, and in an operating room, that is a highly critical problem. Simple mechanical issues connect directly back to patient safety. For instance, if the machine isn't running at all, you might literally just be looking at a blown fuse or a total lack of power supply. If the vacuum pressure is really slow, you could be dealing with a disconnected tube, a leaking seal on the collection bottle, or a blocked air outlet. Oh, and if the microbial filter is discolored, that usually means the internal floating valve is broken and needs an immediate replacement. Identifying and solving these issues rapidly mid-procedure is exactly what keeps the surgical field clear and the patient safe. Let's move to Section 3, OT tables, surgical positioning. When we think of surgery, we naturally focus on the surgeon's scalpel, right? But the operating table itself is a highly engineered device that is equally vital for ensuring successful patient outcomes. It all comes down to achieving precise biomechanical positions based on patient risk factors and the specific procedure. Let's group and define some of these critical postures. First up, supine is your natural, flat position, definitely the most common posture for surgery. But take Trendelenburg. Here, the upper torso is actually lowered and the feet are raised. This brilliant shift in gravity allows pelvic organs to be optimally visualized during lower abdominal procedures. Then we have reverse Trendelenburg, which is head up, feet down, great for head and neck surgeries. Prone positions the patient flat on their stomach for back or cervical spine procedures. Lithotomy involves the patient supine with legs raised and abducted in stirrups. Sitting, or Fowler's position at a 90-degree angle, is ideal for neurosurgery. Finally, lateral places the patient on their non-operative side to expose the hip, chest, or kidney. The table dynamically manipulates gravity to grant the surgeon the exact access they need. Now, imagine the incredible tension of an unresponsive OT table mid-surgery, right when the surgeon needs to adjust an angle by a few degrees to access a critical organ. How do we diagnose these super tense situations? Well, if the table is not responding, it might literally just be that the table isn't switched on, the battery is critically low, or, remarkably, the handset or foot switch just got disconnected. If there's no charge LED when connected to the mains, the supply could be faulty, the main cable could be damaged, or a fuse could be blown. Rapidly checking these basic electrical connection points can literally save a life by getting the procedure back on track without dangerous interruptions. Finally, Section 4. Nebulizers, delivering breathable medicine. For our final stop, we're transitioning from the high-intensity surgical room to a therapeutic recovery device that is absolutely crucial for treating severe respiratory infections and chronic diseases like asthma, cystic fibrosis, and COPD. So the crucial point here is exactly how it functions. A nebulizer is a specialized drug delivery device that utilizes compressed air, oxygen, or even ultrasonic power to atomize liquid medication into an inhalable mist. By mechanically vaporizing liquid drugs into tiny, microscopic aerosol droplets, the medication completely bypasses the stomach and the digestive system. Instead, it travels directly down the airways and straight into the lungs where that localized treatment is needed the most. But what happens when this crucial airway device starts acting up? Clinicians and patients rely heavily on quick troubleshooting here. Common issues include a complete lack of power when the switch is on or a low nebulization rate, meaning that life-saving mist just isn't forming correctly. An abnormally loud machine or one that feels very hot to the touch also clearly indicates a mechanical fault. We really have to emphasize the stakes here. When this machine fails, the patient literally struggles to breathe. Rapidly diagnosing these operational failures is what ensures the continuous delivery of breathable medicine. Which brings us to a final provocative thought to leave you with today. When you look around a hospital room, do you just see standard medical furniture? Or do you now see the hidden engineering that's meticulously designed to keep you alive? From the finely tuned acoustic chamber of a simple stethoscope, to the fluid drawing vortex of a suction machine, to the gravity shifting power of an OT table, and the atomizing magic of a nebulizer, medical care is truly a mechanical marvel. Hopefully, you'll never look at a stethoscope or a hospital bed the exact same way again. Thanks for joining me on this explainer, and keep exploring the incredible systems that power our world.